Minister, we all want to do everything possible to support the people of Ukraine, and I think Ireland has been very generous in its response in saying and indeed acting on taking in as many refugees as possible, and that's what we should do, and we all support that in this House. But I suppose what we also need to do is to look at the individual needs of all of the refugees who are coming here, and obviously as Minister for Health you have a responsibility to ensure that their full health needs are met, that there's a full audit of those health needs, and what I'm asking is what are the short, medium and long-term plans that are being put in place? Thank you.
For the question, Deputy, and I fully agree. Women and children in the main are arriving in Ireland, fleeing from a horrific war, an illegal war in Ukraine, and it's essential that they receive all the health and social care supports that they need. There's a huge amount of work going on between my department, the HSE and other government departments, and indeed non-government agencies to ensure access to the services that are required. This includes access to acute care, to chronic care, to services for children's health, mental health, disability services, maternity care, older people, and indeed many more as well. Additional health supports are being provided where required, including mental health, psychology supports, including for PTSD, for the understandable reasons, and also for services for people with long-term illness. Refugees from Ukraine are being granted temporary protection status, which entitles them to a PPS number, allowing them to access healthcare services in line with other refugee groups and Irish citizens. In the short term, refugees are being provided with rapid access to basic priority primary care in emergency accommodation. And the aim of this service is to identify the need for ongoing clinical care for priority medical conditions, to provide triage, obviously, and to provide for an assessment of healthcare needs for those who are arriving. In the medium and in the longer term, refugees are entitled to apply for medical cards. Now, what's happening at the moment is temporary medical card numbers are being provided straight away. The medical card application form has been translated into Ukrainian and Russian, and there's supports for people to apply then for the more permanent medical cards as well. And it's the application process is now in place, and that is proceeding.
Thank you, and I want to welcome the Minister's response, and I have to say I think the response has been good and has been swift. And obviously there is always more that we can do, but I think the generosity that has been shown by Irish people, but also the speed in which the political system has responded to the needs of the people coming from Ukraine is exceptional. And in relation to Health, Minister, I suppose there's two elements to it. One is we need to make sure that people who are coming get access to the very best healthcare treatments. So obviously what you've said is that primary care initially is the start, and medical cards will be issued to those who need them, which will be, I would say, most of them. So that needs to happen as quickly as possible. But I would imagine that there are people coming who are qualified healthcare professionals as well. Is there work being done to identify who they are, what skills they have, what qualifications they have, and then accelerating matching those qualifications with the standards here to bring some of them into the public system in the areas that they work in, which I'm sure they would assist in and would be more than happy to take part in?
Thanks very much, Deputy. And the short answer is yes. And it's one of the things that I discussed with the Ukrainian ambassador when I met her, is we have a lot of qualified healthcare professionals here. We also have an amazing group of Ukrainian clinicians already here, and we've been working with them to try and send supplies back to Ukraine, humanitarian supplies, and there's a lot has been done there, and we're going to continue to work with the Ukrainian community already here. But as you quite rightly say, we have doctors, nurses, midwives, allied health professionals, or health and social care professionals coming in. They have full rights to work. We obviously need as many clinicians as we can get in our own service, but critically, bringing these people into our service will also help in the provision of care to Ukrainians coming in. It helps with language, it helps with culture, it helps with, they'll have a better understanding of the models of care that the refugees coming in will be used to, and the most appropriate care for them. So yes, we are engaging directly with the appropriate agencies to identify them and to bring them into the system, but in a way that works critically for them, obviously, given everything that they've been through.
Thank you, Minister. Deputy.
Yeah, and again, I think that's very welcome, Minister. And if there are any Ukrainian refugees who want to work here, they should be entitled to work, but also enabled to work. And we know one of the difficulties we've had from people coming from all different countries over many, many years is in registering professionals in terms of regulations and matching those regulations with the countries they're coming from. So is there any difficulties there? So, for example, is there people already who have come who are now going to work in the healthcare system? And if any problems have been identified, will they be resolved? I think it's really important that for those who have any medical qualifications, and we know we talked about health and social care, the lack of therapists that we have in the system, if you have Ukrainians coming in who have expertise and qualifications and skills, but also the language, which is really important because they can then work and engage directly with children, especially who might not have English. There'll be all sorts of difficulties and challenges. So there's a lot of opportunities and benefits to bringing as many in as possible. And I really hope that what you've said will happen and happen very quickly.
Deputy
Thank you.
Cullinane,